Gonorrhea or clap disease. Gonorrhea is an infection that is spread through sexual contact with another person. It is caused by a bacteria called Neisseria gonorrhea. The gonorrhea germs are found in the mucous areas of the body, such as the genital tract, penis, rectum, throat, and vagina. Who are at risk in having this disease? Any person who is sexually active can be infected with gonorrhea. It is common among younger people, ages 15 to 30, who have multiple sex partners. Increases in gonorrhea have been found among men who have sex with men. It is the most common reportable sexually transmitted infection in the United States, with an estimated 800,000 cases of gonorrhea reported annually. Gonorrhea is passed from one person to another during sexual contact that involves vaginal, oral, or anal sex. Gonorrhea infection can also be passed from an infected mother to her baby during vaginal delivery. This can result in a gonococcal conjunctivitis or neonatal ophthalmia in the newborn's eyes. An infected person can spread the infection to another area of their body by touching the infected area and transferring the excretions. Clothing or washcloths of infected people can also spread the infection. What are the symptoms of gonorrhea in men? These are creamy or green pus-like discharge from the penis, painful urination or burning sensation, and testicular pain. In women, symptoms of gonorrhea can include bleeding between periods, creamy or green pus-like or bloody vaginal discharge, excessive bleeding during menstrual period, irritation of the vulva, lower abdominal pain, painful intercourse, painful urination, rectal infection, and throat infection. Men with untreated gonorrhea can develop epididymitis or inflammation of testicles that can cause infertility. While in women, ectopic pregnancy or pregnancy outside of the uterus may occur, and pelvic inflammatory disease, which is an ascending infection that spreads from the vagina and cervix to the uterus and fallopian tubes, which can lead to infertility. Perihepatitis can also occur, which is an infection around the liver. Diagnosis of gonorrhea. Many doctors prefer to use more than one test to increase the chance of an accurate diagnosis. There are 3 laboratory techniques usually used to diagnose gonorrhea. First is staining biological samples. Staining biological samples directly for the bacterium is carried out by placing on a slide the sample of the discharge from the penis or cervix and staining it with a dye. The doctor can usually give you the test results during the consultation. This test is more accurate for men than women, as only 1 in 2 women with the infection have a positive stain. Second laboratory technique is detection of bacterial genes or nucleic acid test. Detection of bacterial genes or nucleic acid test is carried out using urine or cervical swabs to detect the genes of the bacteria. This test is often more accurate than culturing the bacteria. The last one is cultures. Growing the bacteria in laboratory cultures involves placing a sample of the discharge onto a culture plate and incubating it for up to 2 days to allow the bacteria to multiply. Cultures of cervical samples detect infection approximately 90% of the time. A culture can also be taken to detect gonorrhea in the throat. Gonorrhea is treated with penicillin or other antibiotics in pill form or by injection. However, the disease is becoming more and more resistant to many standard medications. Antibiotics that are currently used are cefixime, ceftriaxone, ciprofloxacin, ofloxacin, and tetracycline. The antibiotics ciprofloxacin and ofloxacin should not be taken if you have gonorrhea and are pregnant and younger than 18 years old. Prevention of gonorrhea. Avoid any sexual contact. Proper hand washing is essential as the bacteria can be transferred to the eyes. Sexual relations should be handled responsibly and by limiting the number of sexual partners and using condoms. Visit a local sexually transmitted disease clinic, hospital, doctor, or health practitioner.